Hello, I'm Catherine Cruz, and today I will be covering information on workplace violence and the management of disruptive employees. I was excited to find that this was my topic as it is something that I am passionate about and work with daily in my position in employee health and safety. I hope you find this presentation informative and empowering. The National Institute of Occupational Safety and Health, or NIOSH, defines workplace violence as the act or threat of violence ranging from verbal abuse to physical assaults directed toward persons at work or on duty. Violence can take many forms, as you see listed here. Unfortunately, we are able to see reports of this regularly, as in the case of the nurses who were recently attacked by a patient in Hershey and by a family member of a patient in Philadelphia. While workplace violence is possible in practically any job setting, it is overwhelmingly prevalent in healthcare. The Occupational Safety and Health Administration, or OSHA, reports that the rate of serious incidents requiring days off is more than 4 times greater in healthcare than the average of every other private industry combined. This is based solely on the injuries which are severe enough to lead to time away from work. If we were to consider the number of injuries that are considered minor and thereby not required to be reported to OSHA, and those which employees themselves do not report, you can imagine that this statistic may be even more staggering. Some of the reasons violence is underreported include a lack of understanding of reporting policies or lack of any available policies for reporting, fear of retribution or of disciplinary actions, feeling as though the injury received from the patient was unintentional, and the very essence of nursing, which is first to do no harm. Healthcare workers may be attacked by patients or patient family members, vendors, and even employers and fellow colleagues. The infographic here created by the Bureau of Labor and Statistics nicely captures the ratio of who is most likely to become violent in the healthcare setting. Incidents of workplace violence are more likely to occur in psychiatric settings, emergency departments, crowded waiting rooms, and geriatric units. Other areas at increased risk for violence are those caring for patients with head trauma, seizures, dementia, those going through alcohol or drug withdrawal, patients who are homeless, and those who may be involved in criminal or gang-related activities. Injuries which result in days away from work end up costing both the healthcare organization and the victim. If an injury occurs to a staff RN, that leads to them having to be paid through workers' compensation and be paid for their time off to recuperate from their injury. This leads to decreased staffs and increased hospital-acquired infections and medication errors. Decreased nursing and patient satisfaction can ensue from that, and then that can increase turnover and costs to rehire new staff. I was unable to find a regulated cost of hiring a new RN, but all of it was above $10,000, and some of it went up to over $100,000. There are known environmental factors which can increase the risk of workplace violence, and there are fairly easy ways to improve those factors and to reduce the risk. For most, it doesn't take a brain surgeon to figure it out, as you can see here. Low staffing and working alone, dark corridors, inadequate security, those kind of things are what are going to increase the risk of workplace violence, whereas ensuring that lighting is adequate, that your staffing is adequate, that your security presence is visible, are all factors which decrease the risk of workplace violence. Another type of violence in the workplace comes from inside the house, so to speak. Everyone in nursing has heard the phrase that nurses eat their young. In some ways, the fact that this is a commonly held belief almost makes it a cultural norm in nursing, or something that becomes a rite of passage. However, it is very important that this notion be forgotten, and that employers and employees prioritize reporting this type of violence. The graphic here does a really great job of covering what is not always recognized as workplace violence. In 2013, a survey conducted by the Institute for Safe Medication Practices reported that 73% of respondents encountered negative comments within the past year about colleagues or leaders. 68% reported condescending or demeaning language or insults, and 50% said that intimidating behaviors affected how they handled questions regarding medication passes, increasing the potential of medication mistakes. The Joint Commission and the American Nurse Association encourage a zero-tolerance stance on this type of behavior, with good reason. While singular instances of these types of behaviors may not be harmful, over time they can be more detrimental than just one very traumatizing event. This can lead to absenteeism, depression, stress, decreased work satisfaction, and a desire to leave employment. All of this ties in with something I will speak about in a few slides: disruptive employees. The biggest key to preventing workplace violence and subsequent injury is to promote a culture of safety where there is a zero-tolerance policy regarding any type of violence. A key piece to this is that there must be actual policies in place which clearly state the procedures for dealing with violence and what steps to take in the event of a violent episode. Intolerable behaviors need to be clearly defined and appropriate consequences laid out. Staff should be educated on how to de-escalate situations before they become dangerous, including being mindful of what objects could potentially be used as weapons, where the aggressor is positioned in the room in relation to the door, and how to verbally communicate with an agitated individual. As an example and a resource, I am including links here to Lancaster General Health's policies and also a walkthrough of how to access the Workplace Violence Report, all of which can also be located on StarNet if you are an employee at Lancaster General. If you're not, these are things that you can take a look at and compare to your healthcare's facilities policies if they're in place. And unfortunately, I didn't realize till I started my recording that you won't be able to click the links from the video, but I will be sure to include them when I upload this. Chances are, if you work in healthcare long enough, you will encounter some form of aggression. Recognizing signs of escalating violence, such as tensed body language, elevated voice, or even an outright threat, like, hey, I want to punch you in the face. The first thing to do is to protect yourself and others. Know the codes for different types of violent situations, such as an active shooter or an abduction. Having a direct line to security is helpful, but if it's not available, call out for help. The link here, again, I will share when I upload, shows the surveillance video of a psych patient attacking nurses in a nursing station with a metal bar he pried from his bed. The nurses in the station run for the door and attempt to close the door behind them, but the patient got out behind them and continued attacking. Another nurse who was not at the station at the time ran to lock the doors. The man you see run to the door after them was another patient who also happens to be a security guard. He was able to have the nurse unlock the doors, and he helped the nurses who were being attacked until security arrived. You never know who may be around who can help you. As a point of interest, the nurses lined the halls as the patient who helped them was discharged to honor him for his help, and he later stated it was the nurses who deserve recognition. Once a violent incident is over, we can't just go back to business as usual, although maybe sometimes it feels that way, particularly when there are other patients who need assistance. The first thing a manager should do is ensure that everyone is safe and treat those who are injured. Physical and emotional trauma may need to be addressed, which may take place a few minutes or a few days to really process. All appropriate injury and incident reports should be completed. HR should be notified, and anyone with injuries should follow up with whomever is in charge of workers' compensation. If the situation calls for it, authorities should be notified. As time goes on, victims should be followed up with to ensure their well-being. Now to talk a bit about disruptive staff. I have already referred to one type of disruptive staff member, the one who is considered the bully, or that nurse who eats their young. Again, this is behavior that is sometimes overlooked, but it is crucial to report it as it can do so much damage. She's the one there on the left side. We'll leave her to do her thing for now, though that's not what you should do if you encounter her bad behavior at work. The next type is what the text refers to as the marginal employees. These are the ones who never quite reach the level of competent nurse regardless of coaching and feedback. Their work is sloppy, there are often mistakes in their work, and they just never seem to get it. In this case, the best a manager can do is follow the policies for progressive discipline and termination as necessary. It's important for managers to be consistent in their treatment of these types of employees, ensuring that they're consistent and fair with all of the employees. These may be the nicest people on the floor, but that doesn't mean they make proficient nursing staff. Following that is the disgruntled employee, and this is the Debbie Downer, and every unit has at least one. They complain a lot, usually against the organization, and can drop morale for the whole group. The best way to handle these employees is to set and communicate standards of performance and follow up to consistently ensure they're being met. Also, to document instances of complaints and follow up with the individual as necessary. The final group the text addresses is those employees who are abusing substances. This is detrimental to the individual, the staff around them, and can be dangerous for the patient. In the best situation, the abuse will be recognized early, or the employee may self-report, in which case they may be referred for treatment and possibly be able to return to work after successful completion of treatment. The signs and symptoms should be recognizable and are listed in the text for your reference. Most state boards require reporting of an RN who is abusing illegal substances. If the employee does not come forward on their own, intervention should be planned carefully with a representative from Human Resources and an administration representative present. The nurse manager will have to assess ahead of time if they feel a security officer should also be present. Nurse managers should follow their organization's policies and procedures and follow the state licensing laws for how to proceed. Again, I will upload these to Blackboard when I upload the page. These are a couple of links I thought might fit nicely with this presentation. The first is just 1 minute and 20 seconds long and starts out with a little girl saying, "I want to be a nurse because." It's a brief but impactful video. The second is a video which is the news report of the surveillance video linked earlier in the presentation with an interview with the patient who helped the nurses. The final video link is to a video in pictures describing lateral violence in nursing. It too is brief, just over 2 minutes. The last link is to an article I did not have time or room to go into, but it addresses a current bill which has been introduced just this spring in 2018, named H.R. 5223, which calls for federal legislation to set up guidelines to prevent workplace violence. Currently, the states can opt to mandate that policies be in place in hospitals, but it is not a national requirement. I encourage you to go and read about it and contact your legislators to ask them to support this important legislation. Thank you for your time and good luck with the remainder of your program. But if there's one thing I hope you take away from this presentation, it's that workplace violence is not a part of your job. It should never be something that is expected or tolerated. Your safety ensures the safety of others. If you don't feel comfortable with reporting a violent incident which happened to you for yourself, please consider doing it for the safety of your coworkers.